As it happens, we are going to be talking healthcare right now. We're joined in the studio by a couple of special guests. Franklin Roye and Greg Vassie are the co-founders of IndyCare. That's a walk-in clinic based in Hillsborough. They're called an innovative healthcare hub where patients can be seen by their provider, get their prescriptions filled, and connect with health resources all in the same location. And they've been open since July of 2019 in Hillsborough. And Franklin Roye and Greg Vassie joining us here now in the studio. Thank you so much for being with us today. How are you?
Thanks, Aaron.
Yeah, thanks for having us, Aaron.
So tell us a little bit about IndyCare Health. It's a walk-in clinic, but it's much more than that. So what does it entail?
Yeah, so it's about it's really a retail health model, and when retail health is kind of a way to describe on-demand healthcare that's delivered in a fashion the way that I think some other services are now in society, in terms of it's more centered around you and what you need and when you need it, how you need it. I think conventionally healthcare is kind of the opposite of that. It's like there's this place that has something and you have to go get it whenever they tell you you can.
Right.
So this is just a different approach that's more coming from the perspective of the consumer and trying to offer things that are really valuable, but make it easy to get them, and with a great experience, and where you feel like a person, that's getting a lot of individualized care and service.
Yeah, Franklin and I are both pharmacists, and so I think the overall mission is to help community pharmacies transform their businesses, their brick and mortars, into healthcare hubs or solution shops for their local community. We have a great relationship with our patients, and we're in very rural areas, so it's a place of disparity, and one that we're trying to resolve with having access become easy, affordable, and convenient for everyone.
Yeah, and the IndyCare location is open in Hillsborough, has been for close to 2 years now. I know the plan was to open more in 2020, but the pandemic got in the way, but that only makes your role that much more important. So what have you done to navigate through COVID-19, and how has that changed or affected the way that you've helped members of the community?
Yeah, well, I think it was an interesting test for us to see how resilient our business model was, because obviously when the pandemic hit, the things that we were doing prior to that kind of just went away, right? Most people stopped going into doctor's offices for whether it be, even things that they really needed or things that they may have wanted, and kind of hunkered down. So we kind of had a decision to make, and decided to shift really quickly into helping deal with COVID, and that included things like, getting PPE supplies, not only to ourselves, but out to other healthcare facilities that needed it and couldn't get it, setting up all types of testing in location, which required finding new relationships with labs and partners to be able to do that. So we've gone really heavy into COVID-19 support, whether that be testing for our patients, working with companies, local companies in our area, to help them kind of stay open safely in the pandemic. And then now we're slowly starting to see some of the more normal stuff come back as well, in terms of urgent care and preventative health screenings, labs, and things of that nature, as people get more comfortable with coming back.
Yeah. Speaking with Franklin Roye, just heard him, Greg Vassie as well. IndyCare is a walk-in clinic in Hillsborough. They are the co-founders thereof. And we're talking about COVID-19, certainly, because as everyone else is, for obvious reasons. And we're now moving into this new phase of the vaccine rollout process, where we're changing up the 4 phases into 5 groups. What should folks expect to see in the coming days and weeks and months? What's important for people to know?
Yeah. Greg, I'll let you take that one.
Okay, so it's been challenging, as you can imagine. It's almost like a spigot. I mean, there's only so much of the vaccine that the state is being allocated, and so what I heard was 120,000 vaccines per week, which is not a lot. I mean, and they've been trying to do their best to get everyone lifted off the ground. I mean, they have 2 strategic partnerships with health systems and also with local county health departments. And there's a challenge there where some of their legacy systems are still kind of antiquated, and so getting the word out and getting people processed through has been challenging, particularly in the rural areas. What you're going to see is they're opening up more of a gateway, I guess, with DHHS for other providers to start onboarding themselves and get their own employees registered and vaccinated. But there's some challenges there too, where you have to go through the system, and inside of those systems, it just requires a lot of information.
Mm-hmm.
So what you're seeing is, as people are getting vaccinated right now, they're having a hard time registering the people that have gotten vaccinated, and so there's been a lag essentially to kind of get into the vaccine finders and other things to know where people are in that priority list. So now when they have been, I would imagine external forces push them to get into the 65 and older group 2 with frontline workers. Now you're going to start to see even more of a bottleneck at some of these testing sites,
Mm-hmm.
And vaccination sites.
And with the rollout, pharmacists are going to be involved in this as well too. I'm sure. I know, Greg, you're with the Community Pharmacy Enhanced Services Network, and that's an organization that has a role to play here as well.
Yeah. So with that network, there's two different ways to receive vaccination. The one is through the state, and partnering with them, with DHHS. The other is through a federal partnership, and so there hasn't been any allocations yet, but we're expecting some, information here soon with that. So what pharmacies across, North Carolina are doing is preparing. Mm-hmm. So it's just basically getting the billing mechanism set up, informing their patients, getting a scheduling system put together, and then getting ready to kind of, go whenever we get the green light.
Yeah. Speaking with Greg Vassie, you just heard him, Franklin Roye as well, co-founders of IndyCare in Hillsborough, innovative healthcare hub. You can see your provider, get your prescription filled, and connect with health resources all in the same location, and get health information just in general as well. And as we get further into the winter, obviously we're still in the midst of the pandemic, but it's also flu season, cold season. There's other standard health issues that people ought to be worried and concerned and aware of as well. So how can people continue to keep themselves and others safe this winter?
Yeah, well, it's still a lot of the same things. I think it's one thing that happens, Aaron, is we get pandemic fatigue, mm-hmm. right? And it gets old and tired to wear these masks all the time and not see who you want to see and do what you do. But every time we let our guard down, we see the spikes happen, right? So I think we just have to continue to be responsible to ourselves, responsible to our communities, and follow those recommendations around mask wearing, social distancing, hand sanitizing. A lot of people, the other thing you can do that a lot of people may not be as aware of are some of the preventative steps in terms of supplementation and vitamins. It's very important to keep your vitamin D levels up, and that's true in any winter. It's one of the reasons we have cold and flu season. The shorter days, less sunlight, our vitamin D levels dip, and that's true with COVID as well. So those are some other things that you can do to try to protect yourself and keep your immune system strong and stay healthy.
And then people want to connect with you at IndyCare. Where can they go? What can they do?
They can go to IndyCareHealth.com. We have right now, during this kind of cold and flu season, we talk to our patients about the fact that our tagline is IndyCare is your front door to better, and this season there's really no wrong door to better. So we see patients in a variety of ways. We see them in their homes via telemedicine. We see them in a curbside health setup that we have in Hillsborough, where you can get an entire urgent care visit from your car, including prescriptions delivered directly to your car.
Nice.
And then, for patients that have needs that aren't related to cold and flu, COVID, or respiratory, we see those patients in the clinic now as well. So all of those kind of pathways are available for people right now with us.
IndyCareHealth.com. Go there and find out more. Again, IndyCare been open for a year and a half. They're right in Hillsborough, so check them out there. Franklin Roye, Greg Vassie, thank you both so much for being here with us today.
Thanks, Aaron.